because you suffer from persisting back pain. You wouldn't be here otherwise. And so the title of our talk is the elegant solution for the world's most vexing problem. Okay, vexing really just means it's puzzling the world, and you'll understand why. Because I see patients every day of the week, and Mark's the same. People will have months, years of back pain, and I ask them this typical question as to what is actually causing your pain, and they really have no idea, or they'll say something like it's because of my bulging disc. Okay, and that's really misinformation and a myth. Back pain symptoms are ubiquitous and indiscriminate, and very, very costly on our society, okay? And what I mean by indiscriminate is age and wear and tear the cause of back pain. There is no scientific evidence that that is the reason for back pain, because we know full well that people have back pain and they're already active, okay? So I can have an Olympian with back pain. I can have a triathlete. I've got one of the Noosa triathlon champions who's a back pain patient of mine. So you can't say that his back pain is because of inactivity. I've got people who are very large and overweight with back pain, and I've got people who are very skinny and underweight with back pain, okay? I've got people who have never done any core strength work who have back pain, and at the same time I've got people who go to the gym every day and have got really ripped abs and a massive amount of core strength, and they have back pain. So what I'm trying to point out by this slide is until you actually understand what the discriminator is, a lot of the messages that you're getting are actually incorrect. Special slide here just dedicated to degeneration. We know that people can be elderly and have heaps of degeneration, okay, like that, heaps of degeneration, and degeneration just means just the natural aging, wear and tear on the spinal integrity. Just like this is degeneration of the skin. It's normal. If we can accept that that's normal, then we can accept that degeneration of the spine is normal too. It's not a magical structure that doesn't degenerate, okay? And we know that people can be young and have a perfectly normal scan. So I saw 3 people today with perfectly normal scans that were suffering back pain. So it does not make sense to say that degeneration is the cause of back pain. Degeneration is not the discriminator. Degeneration is a little bit like having high fire danger prairies or bushland, okay? There's no problem with having degeneration. It's normal, but if you subject degeneration to the discriminator that makes it inflamed, like dropping a spark, now you've got a problem, okay? This is a World Health Organization statement in February of this year, 2018. And we're understanding that back pain is one of the leading causes of disability on the planet. And so what does it tell us? It tells us that we're really not doing a very good job of it. We're really not doing a very good job of managing the condition. If we're not doing a very good job of managing the condition, there is a lot of poor rehabilitation that's occurring out there. And if we look at some statistics, we have in Australia today, this is a conservative estimate, about 1.5 million people with back pain today. Chronic back pain, meaning that their pain has been present for more than 3 months. So your question for me is, why is it not going away? What is the discriminator? What is the disease that's causing back pain symptoms? It's primarily a functional movement disease. That's the first thing that goes wrong, is our movement proficiency. And then after movement proficiency sets in, we then start to get these secondary things developing: inflammation, and then structural breakdown of the spinal integrity. And if we start to do these types of therapies, we're not addressing the primary driver, okay? We're addressing downstream problems, and that's what this slide represents. A lot of people will say that my diagnosis is bursitis or tendonitis or arthritis or a disc bulge, okay? These are your downstream problems. These are your secondary dominoes to fall over. But if you only target these downstream dominoes as your treatment and you don't fix this up, you're going to continue to have to keep treating those downstream problems. It makes logical sense to also involve something that stops the first domino from falling over. Okay? And if we conceptualize that movement dysfunction is the first domino to fall over, we can now start to develop a treatment plan that is very focused and specific on stopping that domino falling over. Okay?
Yeah, just like a pretty constant dull ache, like all
across the back,
both sides.
Belt line ache.
Pins and needles every now and again, moving down to the glutes.
Yeah. Glute.
Yeah, tight hamstrings.
So, and all of you, this is not just like for 1 week. This is not just for the last weekend or 2 weeks or 3 weeks. This is how long? Now imagine having a cold or a sniffly nose. Imagine having a sniffly nose for 10 years, Chris. Would you go and go, what the hell's going on here? But this is the thing, when you have back pain, it's like, it's okay. I've had it for 10 years, that's cool. But if you had sniffly nose or a red eye or a, drooling saliva from your mouth, you'd go, what the hell's going on? This is a bit ridiculous, 10 years of drooling mouth. You'd sort it out, right? You'd want to know why. You'd go and knock on a doctor's door and you say, what the hell's going on? But with back pain, what's causing your back pain? But what have you done for it?
Well, since then I've done everything. So Pilates,
there you go.
Massage.
You stopped.
Lots of
Okay.
like running. I used to do a lot of running.
Yep.
I just feel like I can't.
Maladapted. So stop running, and running's great for you. Stopped working. Goodness me. What about you, Chris? What have you done? Paul?
Nerve blocks.
Oh, yeah.
Cortisones.
Nerve blocks.
PRP.
Cortisone.
Countless physios.
Countless physio.
Yeah.
What did the physio do? Just give me an average of what they did most times.
Most of them, almost nothing. They would just...
No. What did they do? You obviously...
They assess the area, and often you go down that...
Did you lie down on the couch with them?
I was laying down there, yeah.
Couch.
Chiropractors.
Lots of couch work?
Yeah.
Lots of times you'd be on a couch?
Laying down, they would try and release some things, get me to move areas around.
Couch.
One exercise.
Releases, yep. Massage, magic hands and magic water bottle. If we look at, now we start to think about cause or disease, okay, because pain is not a disease, right? Pain is a symptom. So now we're going to start to look at what are we doing on this side of the board, okay? Because everything that you guys have said, 100% of it is for this side of the board, symptoms. This is the most important outstanding deficit in your management over the last, 50 years, okay? We have to break that into two things. So we have the structure of your spine, and then the other thing that drives or is the cause for pain is the function. Okay, and they are very closely interrelated. If I have a structural problem, I will have difficulty functioning correctly. If I have poor function, I will develop structural breakdown. So they're interrelated. We want to optimize this interrelationship between structure and function. Okay. What is the prime function of the musculoskeletal system? What is the prime function of that? Why do we have that? It's to allow us to move. Okay. If you're a little slug, you're not moving very far because you don't have a skeleton, you don't have muscles, you don't have bones and joints. So you're a slug. You're there. Okay. So the skeleton is to allow us to move. Now, if we've got a problem with the function of the skeleton, because the spine, this is our axial skeleton, if there is a problem with the function of the skeleton, and our primary goal of having a skeleton is movement, what is the dysfunction? Okay, it's a movement dysfunction. Boom. Okay, so if I MRI all of you, and I'm going to show you MRIs later, and I can say to you guys, it's pretty good. It's not too bad. It's not devastatingly broken. There's no cancer. There's no fracture. There's no infection. There's no spinal cord compression. There's no nerve root compression. If I say that, I can give you a tick here. Okay, I'm going to give you like maybe a B+ or something. But if this is a tick, this is the outstanding problem. Okay, and so I want to focus all my attention to eliminating movement dysfunction. Okay, because that is the driving, this is not really a driving factor anymore, but this is the most powerful driving factor that's creating the disease, that's creating the symptoms, that's creating all that stuff that you guys said. Okay, and the problem is that everything that you did here, everything, not one thing does anything for that. All right, and so all of these treatments are trying to sort this out, but it's going to fail, because if you only have a symptom-based approach, you're ultimately going to fail. These things down here do a big fat 0 for movement dysfunction. Okay, and this tends to be the pattern that people develop with their pain. They have a little bit of pain, it gets pretty bad, they get better again, comes down, gets worse again, gets better, gets worse, gets better. And as time goes on, they sort of spend more time down here. Okay, and when they get better, they don't really get fully better. They're never as good, and then they have another, and it becomes more frequent. And then you're living in chronic pain. Okay? And what we want you to understand is that movement training or movement therapy is everywhere. Okay? Everything you do in life, you're actually lifting and moving your body. You can either do it well or you can do it poorly. Okay? Maybe Emma Jane could relate to that one. And we're all doing lifting, okay? We're all lifting something, whether it's our backpack or our groceries, or whether we're actually doing physical training. We're still lifting, and we want to be doing it proficiently. And these are the points of performance that we want to actually teach you. When it comes to eliminating movement dysfunction, we want to teach you how to maintain hip-centric rotation, how to maintain a neutral spine position, how to engage what we call the posterior kinetic chain, which is right here. That's dissected out of a cadaver. That is the posterior kinetic chain. We want that structure to be healthy because it helps to maintain all of these other factors, and we want you to move within your proficiency limited range of motion. As you continue to move well, that range of motion becomes greater and greater. Okay, so then your ability to do things in life becomes greater and greater. Your functional capacity becomes greater. And what does our research show us? We are getting pretty darn good results. So people like yourselves who have had pain for many, many years, when they learn how to eliminate movement dysfunction, will generally improve their disability scores, what we call the Oswestry disability scores or index, will usually halve those in 8 weeks by just retraining movement proficiency. Okay? Retraining movement proficiency. We don't ever touch your back. We don't ever give you traction or chiro or adjustments. We're 100% focused on optimizing the skill of movement. Okay? All right, and that's what a trace looks like of someone who's dysfunctional. When we put movement recording devices on people's backs, that's what it looks like. After they've done our program, that's what their trace looks like. It's entirely different. And going hand in hand with that is that symptomatic improvement, because we've actually now eliminated the disease. We've eliminated the disease, therefore the symptoms reduce, and therefore you restore functional capacity. Okay? And we transform patients from being a back pain patient to being a healthy person and then becoming super athletic. So these are all my back pain patients that are now returned to athleticism. That a lot of them thought that they could never ever dream of becoming an athlete again. Okay? But that's the standard, that's the natural progression. So this was on the internet not too long ago in a very widely read article telling patients that back pain can't be cured. That is a load of hogwash. Yeah, because we can eliminate the root cause. I'm not just giving you symptom-based treatment, I'm eliminating the root cause of your pain. All right, good. I think that's probably sums it up for me. I'll let Mark introduce himself and then Luke.